I am Dr. Sharjeel and let's solve the challenging case 36. But before unleashing it, if you want to refine your diagnostic skill, then visit challenging cases playlists. So this video was uploaded 2 weeks back on my channel as the challenging case 36, and unfortunately viewers didn't take much interest to diagnose it correctly. Now if you can see here, a 60 years old male patient with a red inflamed right eye and quiet left eye is shown, and then the patient forehead and whole scalp up to vertex is shown. Now whenever there is an inflamed eye and scalp or forehead shown, you should correlate these things, like you should think of port wine stain. It can be secondary glaucoma with port wine, but it is not a port wine stain. If you see there is a red eye, keratitis, perforated eye with adherent leucoma, the patient is in pain, upper lid entropion, and if you look closely at the forehead and head, on one side there are depigmented scar marks. Here you can clearly see depigmented scar marks of the herpes zoster ophthalmicus. So that should be your top differential. You can clearly see that the ophthalmic dermatome is involved in this case, and herpes zoster ophthalmicus, in which Hutchinson sign is positive, boil on your nose during the acute infection, there are increased chances of ocular involvement in such cases. Now in this patient, on history he mentioned that yes, I had Hutchinson sign positive, and the corneal inflammation, the corneal denervation, ocular inflammation occurs especially if both branches of nasociliary nerve are involved. So you can see upper lid entropion, conjunctivitis, corneal epithelial defects, decreased corneal sensation leading to neurotrophic keratitis with constant rubbing of the aberrant eyelashes leading to ulcers formations, and the vicious cycle caused corneal perforation, you can see here, and adherent leucoma. Also iridocyclitis occurs in such cases, iris atrophy, anterior chamber reaction, and raised intraocular pressure when the globe is intact. So in this case you can see all the classical anterior segment complications post herpes zoster ophthalmicus, and after watching this video you will never forget those. Such patients complications can extend to posterior segment as well, with optic neuritis, acute retinal necrosis, optic neuropathy, and even stroke in the brain. Now here the patient is at the advanced stage of blind eye. The patient has NPL vision, and the risk factors are old age, at infection, decreased immunity, greater extent and severity of the acute infection, the rash, decreased corneal sensation, conjunctivitis, keratitis, and uveitis. Now how to avoid it? If antiviral therapy was started within 3 days of the rash, these blinding devastating complications would have been avoided. In early stages of ocular involvement, you can treat the structures, like you can give topical steroids for a stromal keratitis or anterior uveitis. You can give anti-glaucoma drugs for glaucoma treatment. You can give lubrication, and you can treat the entropion, but at this advanced stage you should correct the entropion. You should try to salvage the globe. You can apply conjunctival flap, amniotic membrane graft, and if these measures fail, then you can go to evisceration and enucleation as well.